Hello, we'll be starting the series on family planning. Today we'll be talking about one of the very common family planning methods. In one of our YouTube videos, which was released earlier on, we explained how a woman can conceive. This happens following the release of an egg by the woman. The egg makes its way to the tube from which it goes into the womb. During this journey, it meets up with the sperm, and if fertilized, the products gets planted into the womb as a pregnancy. For a woman who does not want to get pregnant, one of the ways of ensuring this is to make sure that the egg does not meet the sperm, or the lining of the womb is not conducive to receive the fertilized egg. The family planning coil works by making the lining of the womb hostile to planting of the fertilized egg, thus making it impossible to conceive when the coil is sitting nicely in place. There are two main types of coils. We have the copper coil and also the Mirena. The copper coil is also known as copper T. Today we'll be talking about Mirena. The Mirena, when inserted and left in the womb, releases a chemical into the womb. This chemical, which is your normal body hormone, thickens the mucus from the neck of your womb. As the sperm needs to travel via the neck of the womb to reach the egg, the presence of a thick mucus there makes it difficult for the sperm to move through and reach the egg. This same hormone chemical thins the lining of the womb so that it is less likely to accept a fertilized egg. In some people, it is believed that the presence of the coil may also stop the release of an egg. But the first two ways I've discussed are the most popular means of protecting you from pregnancy. Now, having said that, I needed to talk about how important it is for you to have your coil fitted by somebody who is trained to do so. The ability of the coil to protect you from pregnancy depends on how nicely it is sitting within the womb. We cannot just expect to be protected by a coil which is just dropped anywhere within the vagina or just sitting at the neck of the womb. It's got to be sitting in a particular position within the womb for it to have effect. So if you want to trust the results that you get from your coil, it needs to be fitted by a professional, that is somebody who is trained to do so. How trusted is the Mirena coil? For those who like numbers, it is believed that about 99% of women who have had the coil fitted by a professional will not fall pregnant whilst on it. That means that it is very safe, and it is better and far safer than trying to convince your hubby to use condom. It is one of the most reliable means of family planning. Very quickly, I'll talk about the major benefits of the coil, and the rest of this discussion will be shown in another video. The major benefits of the Mirena coil is that it sits in place for 5 years. You don't have to oil it, you don't have to clean it, you don't have to